Hello.
Hey, Dr. Cronin, how you doing?
Good. How are you doing today?
Doing all right.
Great. Thank you for coming on. So, if you could if you could share with us, go back in your history when you were younger, and kind of walk us through, and then what led you to see me eventually, and then tell us what happened. I know you have quite a history.
Let's see. I started therapy when I was 11 years old. My mom has depression, and my dad has a borderline personality disorder. It was not exactly sunshine and rainbows growing up.
Pretty chaotic.
My brother committed suicide in 2012.
Wow. How old was he?
He was 30 at the time. Him and I both have been in therapy since... I was in therapy since the age of 11. I think he started when he was 13. But both of us have treatment. Both of us did have treatment-resistant depression. So, so there's a lot of stuff from childhood that's manifesting itself now. So there's just been a lot of extenuating circumstances surrounding the family. I know my dad's upbringing wasn't exactly sunshine and rainbows either. So, naturally it kind of got passed down to us. But so I've been in therapy since 11, and I've hopped around due to my moving from state to state. And but ever since I've been in California, I've been seeing a psychologist, and he recommended me to you. And going back to how many psychologists and psychiatrists I've had, given I've lived in Illinois, Arizona, I've had a ton. And I have to say I am very happy that my doctor recommended me to you. It's been quite a help considering the circumstances here. So
I think you shared with me too that you had a suicide attempt when you were 11 years old, and
I felt like a pebble in a shoe to my parents. I didn't feel love, so to speak. So it was a very odd thing. But I remember specifically at the time not really thinking. I think I was just naive, but not really thinking about the future or the possibility of even getting well. I was, like I said, our childhood wasn't exactly the best. So it was, it was definitely something that crossed my mind. So
when were you diagnosed with ADD?
ADD, I think I was around 11 when they tested me for it. 13 when they tested me for it, because I was in middle school when they started.
Okay.
They started medication and treatment for that.
Yeah, I think you also had others. Did you have any other suicide attempts after the first one, or ideation at least, or?
Yeah, I had ideations, and even so much to go as far as to have plans. I've had instances where I've driven out to campsites. This is an actual story, but driving out to a campsite, and that was I was going there planning on either not coming back or having a real deep talk with myself. That was a very scary night. There has been other times. It was actually a couple days before my brother committed suicide, but I had taken some sleeping medication, and I just, for lack of a better term, I just didn't care.
Right.
Yeah, and like I said, that was a couple of days before his suicide attempt, and he actually saved my life that night. I accidentally walked into his room instead of my room. I was planning on just going into my room and just falling asleep, and I don't remember much of that night, but they had to put a tracheotomy down my throat, and I stopped breathing, and it was a very scary thing.
How many sleeping pills did you take? You think?
Sorry, sir.
How many sleeping pills did you take?
Geez, I don't even remember.
Okay.
I just remember what was left of the bottle. I just downed them.
Okay.
Yeah.
And so I think when you first started seeing me, you were already on Wellbutrin at the time,
Yes.
which seemed to help somewhat, right?
Yeah, I mean, I can go through the litany of medications, but
You did with me.
yeah, but
You've been through a lot.
yeah. So so far that prior to the Auvelity, that's been the one that has been working the best.
Right.
So
Yeah, I mean, you had tried, a lot. Antipsychotic medications, other mood stabilizers, antidepressants, besides Wellbutrin, and there's nothing really worked for you at all, And so I think the only thing that maybe had a hint of working was the Wellbutrin, and then and you were also on the ADD medication, so.
yeah, it's definitely complemented. The Auvelity has definitely complemented my other medications
Yeah.
as well. It's been it's nice having the Wellbutrin and the other medication in one, and yeah, it's that never-ending tape in my head. It is the Auvelity has mitigated the noise level, so to speak. I don't know if that makes sense, but.
Mm-hmm.
Yeah, it keeps my mood stabilized a lot better. I'm able to, instead of freaking out right away if there's some extenuating circumstances that happen, it allows me to step back and kind of rationally reevaluate the situation and leave a lot of the emotions out of the situation. So
I think you had tried Lamictal, right? Lamictal and gabapentin. I know.
yes.
Yeah. So, well, in a couple visits ago, you were on the Wellbutrin, and it seemed like you were, it was better than nothing, but it still wasn't great. So that's when I decided to stop the Wellbutrin and put you on Auvelity. And I'm going to explain to the audience in a little bit after I get off the phone with you about what that medication does. But it's a very unique medication that has never been one like this before. So it, but it, it adds the balancing of glutamate, which is what's unique about it. It still has the Wellbutrin part in it, but it adds another, and with you truly had treatment-resistant depression for sure, along with ADD. And I think, like I said, I've seen Auvelity in other cases too, just really come in and save the day. I've tried it. Some people can't handle it. It's sometimes too strong for certain people, but when it's the right product, it's really quite amazing. So.
Yeah, because I've been on Wellbutrin and Adderall in the past, and the Auvelity and it's not Adderall, but my new ADD medication, the Auvelity, complements it. I mean, extremely well. But my cognitive memory, my cognitive processing has just I've noticed a change. It's been a godsend.
Yeah, I switched you from Adderall to Concerta, which is methylphenidate ER, which I think it really, like I said, complements the Auvelity maybe better than the Adderall does. But I anticipate with you, and you're only on these two things now. That's it, right?
Yeah, and like I said, I've been on so many medications.
Oh, Klonopin.
For so long.
Yeah.
And it's nice just, for people who know that have to take medications daily and multiple medications, it's nice having, even though it's just 2 in 1, it's nice just having just one medication to worry about,
Right. And you still take a Klonopin here and there when you have anxiety, right?
Yeah, and sometimes we'll even take a half. So it's definitely, it's definitely been leaps and bounds above the Wellbutrin and any other SSRIs or any other depression medication. So.
Yeah, the one weakness, Auvelity is really good for the treatment-resistant depression. The one weakness is it's not going to really help with anxiety. But you've been on so many other preventative anti-anxiety agents that didn't work for you. That's why you're appropriate to be on an as-needed Klonopin, and you don't abuse it. You take it the right way. You take it when needed, and you're not addicted to it. You're properly using it. So. So I think and then I think you're gonna the rest of your life continue to feel like this. You're obviously never gonna go off of these medications, which your genetics is too strong, your history is too strong. So these are going to be long-term medications for you. But who cares? Yeah.
I mean, I've been under that understanding for quite some time now, and if it works, hey, that's fine with me. I don't.
Exactly.
It's better than nothing. So,
exactly. Excellent. All right. Well, It's been great working with you, and I look forward to seeing you again soon. And but thank you so much for coming on. I really appreciate it.
Oh, no problem. It wasn't even a question. Been very impressed with you. I don't want to get too far into it, but my recent hospitalization, my mom, she wanted to give you a third-party perspective on what was going on. She was very impressed with the prompt response and the detail that you've been giving me as far as care. So I just want people to know that, like I said, I've had a lot of doctors, and I'm not one to write reviews, and I choose my words carefully. I'm not trying to say it's to score points, but I'm very impressed with you as far as doctor and helping me out with my current situation. So I appreciate you very much.
Thank you. I mean, and I've told the audience before. I mean, what shocks people is that I return every phone call same day, every email same day, and I guess most doctors don't do that, and that just to me is how I've always operated during my career, and I just don't understand that. I just don't understand, especially with people who do what I do. Things are urgent, and you have to get to things, and so. But I just never understood why doctors they feel like they're too busy, or they possibly just don't care enough. I'm not to disrespect doctors, but there's a lot of doctors out there who just they just don't have good customer service, and that's important in this field of medicine for sure.
Oh, it definitely is, and when I need a refill, like I Walgreens is my pharmacy, and they'll call me when a refill has been called in already. And whenever I've requested it, I mean, if I could show you screenshots, it's literally 2 or 3 minutes later I get a text message from Walgreens. So I appreciate that to the utmost.
Well, when I get stuff on my desk, I like to get it off my desk as soon as possible, because things can get a bit messy on my desk if I don't do that. And then Leslie starts to get upset when I have too much stuff stacked on my desk. So I try to get everything moved off and moved to her as quickly as I can. So
perfect. It works out for both of us.
Yep. Well, thank you so much. I appreciate you coming on.
No problem.
All right.
Bye-bye.
So he was a tough case. When we say treatment resistant, it doesn't mean that treatment won't work. It's just that it's more difficult. And he went through a lot of different medications. So he'd already tried many things. He'd been to many doctors already. They tried serotonin medication, didn't work. They tried norepinephrine. They tried GABA. They gave him gabapentin. They tried Lamictal. They tried antipsychotics, which slow down dopamine. Nothing worked for him. The only thing that seemed to work for him was Wellbutrin, which again works on dopamine mostly, a little bit norepinephrine. And what it does is it forces these chemicals to connect properly, which is good for him. That helps with depression. It can help also a little bit with ADD, with focus. He's also on a stimulant. So being on a stimulant, also things will really start moving better. And he was doing okay on Wellbutrin, but now there's this new medication. It's Auvelity. So it's... Again, I'm not trying to advertise. They're not paying me to say this. They probably should, but Auvelity is a really hot new medication. I have several people on it now. So basically, they have the Wellbutrin in it, so it helps. It was doing what it's doing, but it works on the chemical glutamate. It works on the NMDA receptor sites, which doesn't mean anything, I know, but what it's doing is it's boosting glutamate, which is very unusual. We haven't had a medication that works like that. Lamictal works on GABA, which works in the same area, but it's not the same thing. And gabapentin works on GABA, but it's more for anxiety. So this addition really helps with the depression. And like I said, it's been a really good go-to for people who've had tough conditions like him. And then he takes occasionally Klonopin for anxiety, but not a lot of it. But yeah, if it's just with him being on so many things, so many doctors, two little things he's on, really, maybe three if you want to add the other one. But with him, with his history, being on such a minimal amount and doing as great as he's doing, and he'll stay like that long term. The rest of his life, he'll continue to feel better because as long as these medications are being made, he's going to continue to do very well. So he's a really satisfying story because I love to see people who are difficult to treat. I love to see people who other doctors have given up on. Other doctors have said, I don't know the answer, you have to go somewhere else. So someone like him who's been there and done that, it's really satisfying when I can get to the answer with some of these people and get them better. It's a great feeling. It's why I do what I do with people like him, and he's been very grateful, and his family is very happy also. So anyways, another very good result.